This episode is sponsored by Kerkering Barberio, your trusted partner in tax, audit, and outsourced accounting services. Serving Sarasota, Manatee, and the greater Tampa Bay area for over 50 years, KB helps clients achieve their personal and business goals. Visit kbgrp.com to learn more. John Couris is one of the most sought-after thought leaders in both Tampa Bay and Florida to talk about healthcare leadership and other high-level topics. The Business Observer interviews leaders like John regularly. To learn more about the Business Observer, subscribe. Go to businessobserverfl.com for more. Hello and welcome to the Business Observer's From the Corner Office podcast. I'm Mark Gordon, managing editor of the Business Observer. Today's guest is John Couris, president and CEO of Tampa General Hospital. John, thanks for being here and welcome.
Oh, it's great to be with you, Mark.
Excellent. Well, John, we're going to get into some leadership questions and advice and your career, which has been pretty extensive, I know, in the medical and healthcare space. Before we do that, I'd like the audience to get to know you a little bit. We're gonna hit you with some questions, some rapid fire questions. All right, John, so tell us, what are some of your biggest, one or two of your biggest professional quirks?
Great question, Mark. One or two of my quirks, my professional quirks. Well, one of them's easy. I fly. I don't mind flying, but I don't love flying. And I was told by someone who I hold very dear to my heart, that if you step on the plane with your left foot first, that's good luck. So I always step on the plane with my left foot first. That's one quirk that happens. The second one is a little bit more, kind of like professional in a sense, is that I have a tendency to occasionally over-explain something. I learned a long time ago that the soul of education's repetition. So I'm sometimes very intentional with telling somebody something more than once. But occasionally what happens is I will hyper-focus on a particular thing, and I might tell somebody to do something 10 times in one day, the same thing. That can drive people crazy.
Yes.
So those are two quirks. Now I got a laundry list of them, but those are two that come to mind.
Yeah, and I know we've talked. Do you have kids, John?
I do.
So do the eye rolls go into overdrive when you've told them something for the 17th time, put your laundry away or whatever?
Not only do the eye rolls start, it comes from the kids and it comes from my wife. They all get annoyed by it.
Yeah. What are the two most used apps on your phone?
Oh, the two most used apps on my phone. One of them is LinkedIn, because it's kind of primarily the way I communicate in the business space with colleagues and folks like that. And not just in the healthcare industry, but in general industry and in business. So LinkedIn is something I use every day, actually. And on a personal side, I know this is sort of old school, but I use Facebook a lot. And I use Facebook a lot because my wife and I, we have a pretty large extended family, and it's a super convenient way to stay connected with everybody. I mean, my wife has 10 brothers and sisters.
10 brothers and sisters.
10 brothers and sisters. I've got 2 sisters and a stepbrother. We have a fairly extensive, if you could imagine, a fairly extensive extended family. Yeah. And it is a wonderful way to stay connected with the family. It really is. It's super efficient.
Yeah. Awesome. And last rapid fire question. When you're at your best, what is your morning routine? What is a great way for you to start your day?
Oh, that's a great question. And it's easy. Number one, I get a good night's sleep. And for me, that's anywhere from 5 to 7 hours of sleep.
Okay.
Number two, I have the opportunity to work out or to exercise. I do a lot of walking. I do a lot of cardiovascular work. I used to be a long distance runner, not a competitive one. I just enjoyed for a period of time running long distance. I ran a handful of marathons. I ran the New York Marathon, the San Diego Marathon, the Boston Marathon. So if I can get up in the morning and take a 3 to 5 mile walk, it's awesome. And then, get back and then shower and get into work. It's a wonderful way to start the day. It's a perfect way to start the day.
Awesome. Good sleep and walk. Okay. We're going to move into your career. Obviously, we said you're CEO of Tampa General Hospital, one of the biggest healthcare organizations in Florida. How do you get started in healthcare administration? Tell us a little bit about the early parts of your career.
I am from Massachusetts originally. And I started and got exposed to healthcare working in a nursing home. I was sort of an orderly / transporter, and I got exposed to healthcare through the nursing home business, frontline work, entry level work, and I really enjoyed the work. And what I enjoyed about it was the mission. Was sort of the purpose and the meaning behind the work, helping other people, particularly when they need it the most, really sort of connected with who I am. And so that's how I got exposed to healthcare.
And then you worked your way up through different organizations. I think you were in a couple in Florida before Tampa.
No, real quick. So, I started in nursing home, as I said, as an orderly and like sort of an orderly transporter type position. I graduated Boston University. I was recruited at that point by the Massachusetts General Hospital, which is part of a health system called Mass General Brigham in Boston. I spent 10 years at MGH traversing the health system in a variety of different roles as a young kind of assistant administrator, learning, getting developed, growing, that kind of thing. Spent 10 years there, then moved to Florida. And I worked for a health system actually in Tampa called the Baycare Health System. Came in as a vice president, left as a chief operating officer, and then went over to the East Coast to an organization called Jupiter Medical as CEO, as president and CEO. I was 41 years old when I did that. Spent 7.5 years as president and CEO of Jupiter Medical, and then came back to Tampa General, where I've been the president and CEO of actually the Florida Health Sciences Center, Tampa General, which is a health system that comprises of 7 hospitals, 150 locations, roughly 15,000 team members and physicians that span the state of Florida, not just Tampa. And I just love it. I came back to Tampa and to Tampa General because I wanted to get back into academics. And that's what brought me back to Tampa.
We certainly have that there. You talked about learning in Massachusetts, and I'm sure there was a learning at Baycare and Jupiter and at every stop you've had. Who have been some of your mentors, and what is some leadership advice that stands out to you that you've learned along the way from your mentors?
Well, you know what? It's a great question. So if it makes sense, Mark, I'll do it by decade or by stop, by each one of those 2 or 3, those 3 or 4 places. I think when I started my career at Mass General, one of my mentors was a gentleman. He was also my boss and became a very good friend of mine, was a gentleman by the name of Patrick Jordan. Pat came from the military, landed at Mass General, currently is the COO of a health system in New Hampshire, Dartmouth Health System, up in the middle of New Hampshire. And Patrick taught me a lot of things, but Patrick taught me discipline and focus. And no surprise, because he had a successful career in the military, but he really taught me and exposed me to sort of the idea and the power behind being very disciplined in the work that you do and being very focused. So that's one guy that, in my 10 years at MGB or at Mass General, really, helped me. I will mention one other gentleman. His name is Dr. Jim Thrall. Dr. Jim Thrall was the chief of radiology, where I spent 5 of my 10 years as an administrator in radiology, doing a variety of things. Dr. Thrall taught me the importance of taking the road less traveled, being innovative, being creative, challenging the status quo. Don't go along to get along, don't think differently just for the sake of thinking differently, but be different, be creative, because our industry needs it.
It's interesting because you're right. You just said your industry needs it. Medicine and healthcare sometimes has that, like, we've been doing it this way for so long, so that's why we're doing it. But it sounds like you learned from him in radiology or whatever discipline. Hey, we can be innovative here.
Oh, no question about it. When I left MGEH and went to Florida and went to the Baycare Health System, I had a handful of people that I would call mentors and coaches. The one particular person that stands out for me is a gentleman by the name of Tommy Enzina. Tommy was the CFO of the health system. He became the CEO of the health system. He still is a friend and a mentor and a coach of mine, and he retired a couple of years ago from Baycare, where he spent over 30 years helping really build what Baycare is today. He taught me a ton. He taught me a lot about leading with purpose. Mean what you say what you mean. So, be direct, be transparent, be authentic, just to name a few things. One of the smartest people I've ever met in healthcare, really, one of the best, quite frankly. Wonderful, wonderful person, a great leader overall. So that's somebody that stands out in the 10 years I was at Baycare, and that was really in my 30s mark. When I left Baycare and went over to Jupiter Medical, I had a bunch of mentors and coaches and people who really taught me a great deal. One person, and he's still a mentor, a friend, he's a wonderful human being, is a guy by the name of Doug Brown. Doug Brown was employee number 13 at Enterprise. He helped build Enterprise rental car with the Taylor family, and he is in big part what we know today as Enterprise is because of Doug and his team collaborating, obviously, with the Taylor family, who owns Enterprise. He taught me a lot about the power of vision, the power of team building, the importance of culture in the organization. He still is a friend and a mentor to me that I talk to on a regular basis. So those are, a few people. And now here I am at Tampa General Florida Health Sciences Center, or really Tampa General USF, working. So those are just a few folks that come to mind right now.
You mentioned culture, and I think I'm curious to hear your perspective on culture at Tampa General USF, at your organization, because you guys get a ton of recognition on best place to work lists all the time, and people really do love working in your organization. The culture is always at this high level. But how do you, as a leader, you said 15,000 employees. Obviously you're not overseeing everyone every day. We get that. But how, as a leader, do you maintain and sustain this great culture? What are some of the steps that you take as a leader to do that?
Yeah, I think as a CEO, you have to work on culture every day, in my opinion. I work on our culture every day. Now, some days I spend an hour on it. Other days I spend all day on it. But you're constantly, absolutely, you're constantly curating the narrative, curating the culture, working on it because you need to. It's not something you can talk about and then occasionally work on. It's something you really need to work on, in my opinion, every single day. And so I do that. I will work on our culture and the environment every day. Now, not, as I said a moment ago, not equally every day, but I work on it every single day. And our culture, and when I say and people might ask, well, what do you work on? I work on 4 pieces of the culture every day. And I won't go super deep on them, but they're pretty straightforward. So the 4 pieces are the following. Number 1, I work on the culture as it relates to authenticity and being genuine. I spend a lot of time with my leaders and my people talking about and teaching them the importance of being authentic and being your genuine self. Don't be a version of yourself that you think other people want you to be. Be truly who you are. Because when you do that, it creates a real sense of relatability about yourself. So one piece is this idea of authenticity. The second piece that I work on is this idea of leading and treating people with kindness, empathy, and love. We are very, very deliberate on how we treat each other. It's important that you show up for each other. I truly believe that we are our brothers and sisters' keepers. We have to show up for people. And at TGH and at USF, we do that by being kind, being loving, and being empathetic. The third piece is this idea and notion of being very transparent in the work that you do. People don't like operating with other people in the opaque. People like to know where they stand. People like to know and understand the why behind your decisions. That is transformative when you can do that on a daily basis. So this idea of transparency is incredibly important, and I work on that with my team every day. And then finally, Mark, we work on this notion of really showing vulnerability when you are working with your colleagues. That's incredibly important. Talking about the power of asking for help, admitting when you make a mistake, apologizing for the mistake you made. And what's fascinating about that is a lot of people, a lot of leaders in particular, will say, well, I can't show vulnerability. I'm a leader. I have to show strength. And I have to show fortitude. I can't show weakness. What I teach the team on is vulnerability and strength are next door neighbors in the same neighborhood. They don't live in the same house, but they live next to each other. You can't be strong if you're not vulnerable, and you can't be vulnerable if you're not strong. Showing vulnerability supports the notion of authenticity and transparency. Being vulnerable allows you to be kind-hearted in the way you treat and lead your people. So when you put all 4 of these things together, I work every day on that with my team. Every day. It's very, very important. It's one of the most important activities I work on as the CEO of the health system.
Yeah, it sounds like it's definitely front and center, top of mind every day for you. Are there examples in your career that you could think of where you were particularly, especially vulnerable, where you did admit, hey, I didn't get this right, and sort of the challenge of doing that in front of people? Something comes top of mind there.
Yeah, this was years ago. We were we were evaluating a company to partner with, and I became really enamored with this particular company that wanted us to work with them on a project, on building a product. my team came to me, a guy by the name of Steve Harris. He's one of my senior vice presidents. And Steve said to me, and I'm not going to get into the detail because I want to protect, I want to protect the innocent here.
Yeah.
But Steve came to me and said, look, John, I am going to provide you some feedback and coaching around what you want us to do, because I think what you're asking us to do is going to be a mistake. I think we're not going to be happy with the outcome. So he came into my office. He said, I'm going to test the culture, kind of this idea of truth to power. I'm going to explain to you why I think you're wrong, why I think you're going to make a mistake. And he did exactly that. He laid it out beautifully for me. The long and short of it is, I turned to him and I said, Steve, I think you're 100% right. I think I was about to make a mistake. Let's go with what you want to do. I think you're correct. I think I was about to make a pretty big error. And for that, I'm glad you came to me. We went with his solution. One of the best things we did.
Yeah.
One of the best things we did. Huh?
You got to take your ego out of it, right? Because if your ego was in it, you probably would have been like, well, we're going to do it this way because I already came up with the idea. And not the idea, but I'm already down the track on this and I like this idea.
Well, that's true, Mark. You're absolutely right. But you also, as leaders, we have a responsibility to create a psychologically safe environment for people to be comfortable challenging the boss or challenging each other. And that only happens if you create an environment where people feel psychologically safe. So when they do use their voice, when they are the contrarian in the group, they know they're not going to get in trouble for it. They know they're not going to be judged for it. They know it's okay to make mistakes. They know it's okay to be wrong. So you're working on because all of this is part of this, basically a virtuous cycle that we're creating in the organization to drive performance.
And loosely related to that culture is promoting, hiring, moving up good leaders. What are some things, John, that you look for that stand out or good leadership characteristics at TGH and USF, whether it's a promotion or hiring or any other part? What stands out as good leadership characteristics?
It's a great question, Mark. Well, not to beat it completely to death, but we're really, really consistent and very focused on our culture. So I look for people who possess the ability or already have it that can support the culture. I look for people that are authentic, that are kind, that are transparent, and that are vulnerable. I look for people who can practice that every day. And I'll give you a couple of examples of what I mean, because you might, the listeners might be saying, all right, already, we get it, it's culture. But this stuff is really hard. And most of the people who say we get it don't really get it. They don't. And I'll talk about that in a moment. But I have a lot of longevity. I am blessed with having a lot of longevity on my senior leadership team, the people that report directly to me. I have a handful of people who have worked for me or have known me, and I have been involved with for over 20 years. I mean, I've got some people that have been working with me for 20 years, 25 years. My chief administrative officer has worked for me for 16 years and has traveled with me over to Tampa from the East Coast. And I'm not suggesting that I'm perfect, because I'm far from it. I've got plenty of idiosyncrasies that I work on all the time. I really do. But I look for people who sort of fit this mold of, like, are you genuine? Are you who you are and not a version of yourself that you think people want you to be? Are you kind and loving and empathetic to others? Can you truly be transparent with people? No backstabbing, no backbiting, none of this clickiness. You're in the clique, you're out of the clique, you're in the clique, you're out of the clique. That's all junk. And then, are you vulnerable? Can you ask for help? Can you admit when you make a mistake? Those kind of things. I've made changes, Mark, in my own organization, and have asked some senior leaders to leave because they were either unwilling or incapable of supporting the culture. I will not tolerate that. Now, I will give people lots of time to get better, to explore, to learn, to grow, and to develop. But at some point, you have to call the question. People don't get in trouble in our organization because they made a mistake or they failed at something. They end up not doing well in our organization if they're unwilling or incapable of living and supporting the values and the culture. So that is super important to me. Another thing for the listeners to think about, and this goes for any industry, not just healthcare. But obviously we'll you continue to use healthcare as the example. In healthcare, just like many industries, strategies, there's not a lot of novelty to strategies in well-established industries like healthcare, meaning that each health system, if you look across the country, their strategies, our strategies are sort of variations of a theme, if that makes sense to you. Like everybody in healthcare, in my case, everybody in healthcare is talking about, well, we need to do more ambulatory care. We need to hire more doctors. We need to modernize our facilities. We need to focus on care coordination. The big thing now is consumerism. It's all about the consumer. We're all generally focused on the same things. Now these strategies are configured differently, but they're generally the same. Here's what's very different, Mark. Very different from health system to health system. The people in the health system, the culture of the health system, and the ability of the health system to execute on a plan. And for the listeners that are listening to this, think about the businesses that you either work in, lead, or own. And then compare yourselves against your competitors. And then ask yourselves, are my strategies really that different than the next organization? Or are my people, my ability to execute on a plan, and are my culture very different? I would submit to the audience that it's about people, culture, and your ability to execute that's very different. That's why culture is so important. Because, Mark, if you get your culture right, which means you've got to get the people right, the ability to execute on a plan and get work done and drive results is incredible. It is. It is absolutely incredible. And I'll end with this. If I compare I compete with a lot of great systems, no one can out execute us. Nobody. When we go into a market and we make up our minds to do something, there are very few people, if any, that can outcompete us. We may not be the biggest, but we are absolutely one of the best. And it's because of our people, our culture, and our ability to execute on a plan.
Yeah,
that's the power. That's the power of a culture.
Well, and that's such a great explanation of it. And I can't think of the top of my head who said it, but it's culture eats strategy for breakfast, right? I mean, that's that ultimate cliche of what you're saying. Excellent, John. As we wind down, as you mentioned before, 15,000 employees and 150 locations. I feel like there's always something happening. Your awesome press team sends out press releases to the media regularly. And I try and stay on top of all of it. But if there's one or two things that you're particularly looking forward to that's coming up for the organization? Say we're about a third of the way into 2025. What are one or two things you're particularly excited about this year?
Two come to mind. The first is our relationship with University of South Florida and USF Health and the Mersani College of Medicine. So late last year, we became clinically and financially integrated, and we became a very traditional, sort of classical academic health system, an academic and research health system that's university-based. We're actually the largest one in the state. I'm really excited about the work that's going on with the university. And that's really starting to explode, and really the momentum behind it is fantastic. We're hiring more faculty, we're hiring more clinicians, we're doing more research, we're growing more facilities, we're improving quality clinical outcomes and safety, we're driving real value in the communities that we care for across the state. I am super excited about the relationship, and I'm really excited about the fact that we are clinically and financially integrated, which is powerful. We are a very traditional but contemporary academic and research health system. So that's one project and program I'm really, really excited about. The next is our relationship. We have a very robust relationship with Mass General Brigham. You talk about full circle. We invited Mass General Brigham to come in years ago to help us build a bone marrow transplant center at TGH. And they did a fabulous job with our physicians, with our doctors, but we needed some help, and they were there, and they showed up, and they really helped us. That relationship has blossomed into all sorts of clinical work, joint ventures on the business side, knowledge sharing between their health system in Boston and our health system in Tampa and across Florida. We have 20 clinics, close to 400 team members and physicians over on the East Coast. We just announced a new cancer center that we're building with Mass General Brigham on the East Coast of Florida in Palm Beach County. And we're just getting started with that relationship. I am really excited about our collaboration with them as it relates to building out, again, sort of a big system, a big academically oriented system across the whole state. There's lots more, but those are the two that sort of just pop up and are sort of front of mind for me. Very, very, because if you think about the work we're doing with the university, it's transformational. The university is a top 50 public university in the country. And then if you think about the MGB work, well, they're one of the top academic health systems in the United States as well as the world. They're a major player, and to be able to collaborate with them, build with them, grow with them is really fun. It's not only fun and very intellectually stimulating, but it's a big deal for the state. It's a big deal for the state. So I'm excited about those two activities.
Excellent. Well, John Couris, President and CEO of Tampa General Hospital, thank you so much for joining us on the From the Corner Office podcast.
Yeah, thanks for having me, Mark.
Thank you for listening to the Business Observer From the Corner Office podcast. I'm your host, Mark Gordon. This podcast was produced by Reed Corley of the Corley Company in Sarasota. To hear more episodes of From the Corner Office podcast, go to businessobserverfl.com.